Hi there. If you have already watched my asthma versus COPD concept video, these MCQs will feel too easy. In the last video, I explained one concept that solves 90% of asthma and COPD questions worldwide. Now let's see how examiner twist the same concept in USMLE, NCLEX, and PLAB and pharmacy government exams and GPAT, OBRA, NIPER exams. If you haven't watched that concept video yet, pause this and watch it first. Link is in the description. Same concept, different exam style. Let's start. Just remember this one line memory lock. Asthma, inhaled corticosteroid should be given first, whereas LABA never alone. In the COPD, LABA or LAMA first, LABA allowed alone. Here is the first question in USMLE style. A 22-year-old woman with episodic wheezing and reversible airflow obstruction is prescribed a long-acting beta-2 agonist as monotherapy. Which of the following is the most appropriate correction to this treatment plan? So the options are A. Continue LABA as monotherapy, add inhaled corticosteroids, C. Replace LABA with a leukotriene antagonist, and D is add theophylline. So the answer is B. Why B inhaled corticosteroids? A woman with episodic wheezing and reversible airflow obstruction. So reversible airflow obstruction immediately tells this is asthma. LABA alone in asthma is dangerous. So asthma is an inflammatory disease, so inflammation must be treated first. Answer is add and inhale corticosteroids. For the exam tip, never use LABA alone in asthma, always combine with ICS. The next question is in the format of NAPLEX or pharmacy board style. The question is which statement regarding pharmacological management of asthma and COPD is correct? Options are LABA monotherapy is safe in asthma, B is ICS has no role in asthma, C is LABA monotherapy is acceptable in COPD, D is leukotriene antagonists are first line in COPD. So here is the answer is LABA monotherapy is acceptable in COPD. The question which statement about asthma and COPD treatment is correct. So here we can apply elimination logic. ICS has no role in asthma. That is wrong because ICS has a role in asthma. LABA alone safe in asthma. No, it is dangerous. LABA and ICS should be given in asthma. LABA monotherapy is acceptable in COPD. Yes, it is correct. So answer is LABA monotherapy is acceptable in COPD. So remember, COPD is not primarily inflammatory like asthma. The next question is in the format of PLAB or UKMLE style. The concept is same, but the structure of the question is different. So here the question is which treatment approach best to differentiate asthma from COPD? So coming to the options, bronchodilators are the first line in both. B is inhaled corticosteroids are mandatory in both. C is LABA alone is contraindicated in asthma. D is montelukast is useful in COPD. There is LABA alone is contraindicated in asthma. So in the question, what differentiate between asthma and COPD? So the key difference is both uses bronchodilators. So that not the answer. The concept is LABA alone is contraindicated in asthma. So remember the concept, LABA alone is contraindicated in asthma because asthma is an inflammatory disease. So first we have to give inhaled corticosteroid to treat the inflammation. Part 2 is coming next with different question patterns. Like and subscribe so that you won't miss any exam question pattern and you will be get updated on the topic with concept zero stress.